More coverage tonight of the COVID-19 vaccine, and again, we're bringing in some historical context.
NBC 26's Kelsey Dickinson explains how the COVID vaccine will play a part in that and what its future could look like.
The World Health Organization has declared only one disease affecting humans as officially eradicated, that being smallpox. Others, like polio and the measles, are now partially controlled with vaccines, a tool health officials say they hope will do the same for COVID.
In using a vaccine strategy to address a virus, it is both a combination of a good vaccine, high vaccine coverage. It is also about continuing to study if the virus is changing or mutating.
We can examine that strategy through other viruses. Because of continued vaccine use, polio, for example, hasn't originated in the U.S. since 1979, 24 years after the initial vaccine rollout. But that virus still exists in other countries, which is why people here in the U.S. continue to get the shot.
We have been able to stem out polio from most of the world except for Afghanistan and Pakistan.
Rotary International has been working to eliminate polio for the past 30 years. Officials say it's hard to know if they'll need to extend their efforts to COVID.
We have found cures for polio prevention, and we have this experience of over 65 years. COVID, on the other hand, is very new, and we are still understanding how this disease actually manifests.
Other health officials say the COVID-19 vaccine is comparable to the measles vaccine, which is 95 to 98% effective.
We know that, during measles outbreaks that it can circulate and find those individuals who are not protected.
She says the same thing can happen with the coronavirus, which is why it's important to get the burden down.
It remains to be seen about these variants and whether we will need boosters to go ahead and ensure that we have good protection against infection.
Officials say the key will be to use the vaccine to develop that herd immunity, like people have done with the viruses of past. Kelsey Dickinson, NBC 26.